Hi, welcome to Pro Bono Clinic at University of St. Augustine. We're going to be doing an orientation today to get you familiarized with the flow of student clinic, the equipment, and then we'll do documentation, which documentation will be a separate video to get into the nitty-gritty details associated with that. So to start, just to summarize what to expect in Pro Bono Clinic is that you're going to schedule your patients, okay? They'll come in Mondays and Wednesdays from 12 to 1 o'clock, 12 and 1 o'clock appointment slots, and you'll treat your patients either by yourself or with your colleagues, with mentors shadowing you and helping you out in the clinic. And then after that, we'll have another hour session where you'll be working on your documentation, filling out all that paperwork because we will be signing after you. And then we'll also do what we call a powwow session or just reflections where we'll talk about your cases. We'll have lessons that we'll discuss and just kind of pull it all together, all the clinical reasoning and experience together associated with that. So that's kind of the general overflow of what to expect in student clinic. So let's break it on down to all the different divisions. So signing up your patient, getting them going. So in general, you'll be in here for 3 weeks at a time. Each student will be in here for 3 weeks, and we expect you to manage at least 2 patients a week. Okay, so you have 4 treatment slots each week, but you're typically only going to be managing 2 cases. So that's not a difficult task. That's all we want you to do. It's your responsibility to manage that. If you don't have a case, you need to reach out to us to find a case to get yourself a patient so that you can get a good experience in Pro Bono Clinic. So you will indeed contact the patient yourself. We will provide you with a patient. At the beginning, we're going to toss out a lot of them, and you're going to schedule them, get them their appointment scheduled, and then you're going to place their names in the scheduling book that we have for you guys. It'll usually be a 3-ring binder with a scheduling system in there, or we'll move to an EMR system and you'll plug it into the EMR system where you'll identify when a patient's coming in. That way we know what's going on and other people know what's going on and when people will be coming in. So again, it's 12 noon, 1 o'clock appointment slots. You fill that in, days, times, and all those details. And you'll be instructed on that. So once the patient's scheduled, they'll come in to see us whenever you're scheduled. And you are going to ask that patient to come in 10 minutes ahead of time so that they can fill out any intake forms that you may have for them, which we will have all of that documentation system and we'll walk through that. But ask them to come in early for the first treatment session so that you can get them going and start your evaluation on time, because we want to utilize that entire hour time slot to give you the best experience. So there will be people helping you. The mentors will be here kind of walking you through that first day as well and all the other days. But you'll bring your patient in and you'll do what you need to do. First day is going to be your full clinical examination, working through all your steps and what you plan to prepare for that case. It may be a neurological case, it may be an ortho case, it may be something that you're doing a co-eval with an OT. You may do a PT eval, and then there'll be an OT eval afterwards, and you guys will collaborate with each other to figure out what you want to do with treatment interventions or treatment appointments in the future. So all of that could happen within the setting. You treat your patient, you do what you feel clinically necessary with mentors shadowing you, helping you, giving you guidance. If you have any questions whatsoever, we're there to help you. Somebody will be there to help you. This is your learning experience. I want you to remember that. This is your experience. If you don't reach out to us, we don't know if you don't know something. So really take it upon yourself and take the initiative to get as much as you can out of Pro Bono Clinic, because again, if we don't know you don't know something, it's hard for us to fill that out. So ask questions, be intuitive, be approachable, and just make sure that you take care of your case as much as you can, but know that we're there to help you. But the onus is on you as a clinician. You're taking care of your case, we're there helping you. So you treat your case, you do everything you can, and when you're done with that, you do indeed have to fill out the documentation system associated with that treatment session. So documentation is a legal form of documentation here, and even though it's Pro Bono Clinic, this is a legal documentation system. These things have been subpoenaed in court before, so whatever you write and whatever you document, the mentors that are there will indeed have to sign after you, just like a clinical internship where the mentor signs after the student. Okay, so it's a legal document and everything will need to be combed through and done well. And all the charts and stuff will be held in the clinic. They don't leave the clinic because we need to keep those safe because they are legal documentation. So notes will be done in class, right? So notes will be done here. We give you that extra hour after you've done your treatments so that you can finish that up, answer any questions, get it done so that the mentors can then get it, sign that form, sign that documentation for you, you file it away, and then they stay here in clinic and you can pick those files up the next time you come in to treat that patient. So those are the logistics of that. The documentation, just to kind of simply flow through that, remember there's going to be another video to walk you through all the details associated with the documentation system, and so watch that video. But in general, you know, there's the typical intake forms, okay? You have the patient fill out the liability form. There'll be, you know, patient record information, and you'll keep a log of dates of when you'll be seeing these patients and tracking how many times you see them. Then it falls into, you know, medical questionnaire, and then a pain chart, a pain scale, and a functional index scale. All of that will be done in the intake form section and whatnot. And you can hand that to the patient either ahead of time if you have access to give that to them ahead of time, or they're coming in early so that you can have them fill that out and you can get started with your examination on time. And then it goes into an examination form, right? Whatever case you're seeing, you know, again, neuro, ortho, the spine, neck, extremity, lower extremity, TMJ, you're gonna choose one of those forms to roll through your examination. You fill those out as you're going through your case, and you're gonna need, I can't express this enough, you're gonna need to familiarize yourself with those evaluation forms before you come in the clinic. You need to practice ahead of time. Otherwise, it'll be a disaster on your first day of evaluations and examination day. So get that practice in, be familiar with that evaluation form when you come in. So you do the history form, you'll do your evaluation at the end, your blurb of what you think's going on, your POC, all that will be there, and then you're gonna set up a plan for what you think they need to do, and schedule that patient out a couple weeks ahead if you think they need to be coming in for more physical therapy. So you'll put that in there, the patient scheduling chart, to identify when they're coming in, to let us know. And it's important because it's not just physical therapy profession plugging this in. The OTs, the speech language pathologists, and maybe even the nurses will need to know what patients are coming in, and maybe they could do some co-treating with us or whatnot. So that's important that you document or look out ahead of when you think these patients will come in, and get your patient to commit to those dates, so that'll keep them coming in. Again, you're responsible for managing your cases. And then last but not least, you'll have in your packets that all your documentation is in, and we'll show you here in a second, a discharge summary, a patient survey as our student survey to see, you know, how well you did from their perspective, and all that will be documented, signed, sealed, and then filed away in a discharge file. Okay, so that's kind of a blurb of the documentation system and what to expect and what you'll be seeing there. So with that, we're going to somewhat flow through a little bit of where is all this stuff. Okay, so here's our filing cabinets and everything here. Where you're going to find your documentation is in this top drawer of this tan filing cabinet. Okay, so up in here you're going to see a bunch of different files, and you'll see upper extremity, lower extremity, back name. There'll be a neuro file and all of those things. And in here there's a packet, right? So let's say you have a lower extremity case. It's a knee, it's an ankle, it's whatever. You're going to pull that packet out, right? And that's what you'll go through, and this has all your documentation form. You know, your lines for progress notes, all the examination forms, your intake, the liability stuff. Everything will be in here ready for you to go. So you'll take it and maybe pull off the first 4 or 5 pages to hand to the patient to fill out, either before they come or the 10 minutes ahead of time that they show up. And then that packet, you know, once you have that going, you'll need to grab a manila folder for them. And by the way, in this filing cabinet, there's extras, you know, so besides the packets, there's the kind of individual pages of each one of there that you can grab. For instance, say you run out of progress notes pages and you need more room to write notes, there's, you know, pages in here with more lines for you to plug in. There's more discharge forms. You know, if you lose something happens, hopefully you don't lose anything, you can add that into the patient's chart. So you grab that packet, and then you need to get down here at the bottom. So you go to the bottom drawer. Let me get over here. And you're going to grab a manila folder. Okay, so that packet that you grab for your patient is going to go in this patient's chart. Okay, so this will now become that patient's chart. So let's say it's Joe Smith. You'll grab one of these little tabby things here, right? Little sticky tabs. Boom. Cover up the old name on the chart if there is. If there's not, you got a new one now. And you're going to write the patient's name on this chart. Okay? Boop. And now that's their chart. Last name first, first name second. So last name, comma, first name of the patient. And then you will also have that form that you received to call the patient with the patient's contact information. That'll also go in this file. Okay? Again, all of this is gonna stay here. So now you've made your patient chart, and this is what you'll have while you're treating your patient, you know, doing your examination and the follow-up treatments. You'll be filling out your documentation here. This will be handed to us, right, at the end of the treatment session in that last hour. We'll sign it off, and then that is going to be filed, right? These will be held in the black cabinet. The top 2 drawers are where the active patients are, the ones that are currently being treated. So in here, you'll see there's an alphabetized chart. So A through M is up here at the top. And let's say I said, I don't know, John Smith. What did I say? John Smith. So he wouldn't go up here. He would be filed away in the S's, which is in the second drawer, right here in the S, right? A, B, C, D, E, F, G, right? Right before you. Boom. After the documentation is signed by the mentor, and you know, obviously you've completed all your documentation, it goes in here to sleep through the night until the next treatment session you see. So when you come in for your next treatment session, the first place you should be heading is to these files to grab the patients that you'll be seeing that day. You come in, find your patient's chart, pull them out, and you're ready to rock and roll. Okay? Now, once the chart is done and you finished the entire treatment session and you've done the discharge summary and everything is signed, the 2 bottom drawers in this thing are your discharge files. You see this? It says discharge. Patient discharge, okay? So these 2 are the last, or the discharge filing cabinet. So up here again, it is the A through M discharge file. Down here is the into the last bit. So that would be filed away. And again, if this was a finished document and this was, you know, Joe Smith, it would go under the S's, right? Boom, filed away for discharge file. So active patients right here, active patients, discharge once they're done with treatment. Okay? So that's kind of the summary of where to find all this paperwork and what you'll be doing day 1 when you come in here to get things done. Okay? Manila folders here. And again, let us know if things start to run low. If you're running low on supplies, any of the paperwork, any of the eval forms, try not to take the very last one if you can. But if you have to, you have to. But inform us so that we can print out more for you or, you know, get you more. And then if there's manila folders going low, we recycle those. So I have a ton of them, and we'll add more to the pile so that you'll have something for your patient to get going. Okay, so that's the filing cabinet, the blurb there. Now we're gonna go into just equipment. We're just gonna kind of walk through the equipment. So we have 2 cabinets for the physical therapist, a cabinet for the occupational therapist and all their equipment. And as you can see here, we just got all your go gadgets for clinical care. You know, we do have a couple of goniometers and things roaming around, but what you will need to bring into clinic for yourself from your own gear, okay, this is important, okay? Bring in your own goniometers. You're gonna need your blood pressure cuff and your vital, you know, assessment sign. So bring in your blood pressure cuff and your stethoscope, okay? So you'll be checking vitals on each patient too, all right? There's a place on the evaluation form to do that. So you will check vitals every day, every time a patient comes in, because that's standard care practice. And so those, and you can bring in whatever tools that you primarily like, you know, and if you have some things you like, by all means, bring those in. But in general purposes, we have, you know, a few things here. So we have massage cream. You don't need to bring, you know, your soft tissue prep stuff in here. We've got tape. We've got, you know, belts, manipulation belts, a thing that's sort of, Kelton wedge. You probably have one of those. You might want to bring those in too, because we only have a few of each. So there's usually going to be 18 to 20 of you guys in here at a time treating. So the supply might not go around. So if there's something you like and want, bring it in, even if it's a belt or something like that. There is going to be TheraBand provided by the university that we can indeed give out to the clients. So at your discretion, obviously, you know, use your judgment. Don't just throw this stuff away. So it is expensive, and it comes out of our budget. So be judicious on how much you give out, but you can indeed give the TheraBand out, and there's colors. That's the only thing that you can give away in this equipment thing. Obviously, the tape you use, you won't be taking that back, but if you use a belt, let's say there's some SI belts in here too that you can use. If you do use one of these, we have to really manage those. That needs to come back to the clinic. So you're usually going to do something like this. You're going to use it as a test to determine if it's going to work for the patient. Then if it works and you feel like it's needed, you're going to instruct that patient and show them where to go to purchase it themselves. Okay, so this is not to be given away. The only thing to be given away in our quiver of supplies is the TheraBand. We'll have bars and all of that stuff. That does not leave the clinic. It stays here. Again, cones, we got foam rollers, we'll have, you know, balance stuff, and all of that equipment will be here for you to use you know, just like a clinician. And that's about it in there. And again, this cabinet will be full of equipment too, various things in equipment. Treatment tables will be spread across here. Now we're in room 102, 104. So maybe pick your spot, you know, kind of find which one you like. Obviously, high-low tables are great, but not all of them are high-lows. There should be enough to go around for the 18 to 20 students, but pick your spot. If you need privacy, okay, if you need privacy for your client, there will be some dividers that we're trying to get set up in here that you can set up to get that privacy. If not, come and see us. We'll manage it. We'll maybe take you somewhere else where if you need that privacy, we'll get it for you. Just added, we have a low mat table that actually folds up like a Murphy bed. So here is a great place to do some low mat table activity. Over here in this corner, you can see there by the clock, is kind of a warm-up station, your cardio equipment, and then we have, you know, the Cybex machinery that you can use for any type of strengthening, conditioning, things that you want to use for your treatment. So that is kind of a corner of our operating clinic there per se, but great place to warm your patient up, to get things going, and work with that. We do have modalities. You'll see there be a freezer with ice packs, and other modalities will be here for you to use as well. Linens, obviously linens are here in the room just like you'll need, so grab your pillows, grab your linens for your patients. Try to switch that out, you know, from client to client. So from your 12 o'clock patient to your 1 o'clock patient, you probably want to change your linens and do that just like you would in any regular lab or whatnot. So hand sanitizers will be floating around, so remember hygiene, personal hygiene, work all those things out. And I think that covers about everything as far as the flow, logistics of the clinic, what you can use. Oh, sorry, that is not it. You do have access to the wellness center, the pool. All of that equipment is utilized by Pro Bono Clinic. So we have access to that. If you want to take a patient over there and work with them in the gym or the pool, just notify one of the mentors that you are going over there. You may ask us to come with you, but if you want to go by yourself, you're allowed to do that. But just let us know where you're going with them, okay? And if it's, you know, any other issues going on, we'll take care of that. When it comes to security, getting the patients in the building, so they don't have access to get into the building if it's an external client coming in. You just communicate with them, and we'll either have one of the assistants that will be in Pro Bono Clinic helping us go and get them out there, or you yourself will walk out either to the parking lot or outside the building to get them in and escort them into this building because they don't have access to get in here, okay? If it's a student and they do have access to get in here, they'll simply meet you right here at these double doors and wait outside in the hallway for you to come get them before they come in the clinic. So we don't want people barging in, you know, in the middle of other treatments and just walk in and say, you know, I'm here for treatment. They need to wait outside to let everyone finish up their patients before they move in here.
Not admin or First Coast.
And, well, great point. Another thing to remember is to not send your patient to the admin at First Coast. So First Coast Rehabilitation is a separate clinic. They're their own entity. So they may wander around and find themselves in the lobby of First Coast. Educate them not to go there, okay? So we don't want to bother them. We don't want to bother their business. And just educate your patient not to go to that lobby, to wait out here or either outside for you to get them. And again, if it's hot outside or cold outside, make sure that you're in communication with them and you know, are there when they get there so that you can quickly get them inside and it be comfortable and appropriate for them. But otherwise, guide your patients to this hallway right here, and they need to wait outside in the hallway to get you in here, okay? I think that's it. Signing off for Pro Bono PT orientation.